How is everyone? How is Arab Health Day 1? Is there a lot of noise? We'll make more, but with a lot of applause. Any question, okay, to myself and to our panelists? Let's start with how many society we have in Emirates Medical Association. Is there any question? No ChatGPT, please. Okay, I hope that at the end of the session we'll have, the answer. This is number one. Number two, did you have the opportunity today to hear about innovation, technology, healthcare? Yeah? A lot. But who is delivering this healthcare? Who is delivering it? Do we have physicians here? Fantastic. Do we have nurses? Do we have therapists? Are you all business people? Who is caregiver? Hands on. Hands on. Okay. Then, this is a fantastic house, yeah? This is a DNA. For the DNA of M42 is innovation, is technology, is to be here for everyone, partnership. But what is the DNA of a caregiver? What is the house of a caregiver? The Emirates Medical Association is this house, is your house. But I hope that by the end of this session, you will know what is the Emirates Medical Association. And for the one who are not enrolled, okay, we have a QR code there that you can do it and live the Arab Health being a member of this prestigious organization. A big applause to my panelists. One more time, please. Thank you. Can I invite you for the mic? Assalamu alaikum.
Wa alaikum salam.
Okay. Then, first of all, happy 2025.
Thank you.
Second, congratulations for new board for Emirates Medical Association.
Thank you.
Thank you. Extremely happy to have you on board. But as you've seen, several members of our audience don't know how many society there is. Maybe don't have the details about the Emirates Medical Association. Then, kindly, Sheikha Dr. Noura, can you tell us more about Emirates Medical Association?
Thank you so much, Dr. Fatma, for the beautiful introduction, and having us on in the program of M42. We are delighted, myself and Dr. Zuhair, as the board member, Emirates Medical Association, which is EMA. It has been we are delighted once we have been invited. We said it's a great opportunity to showcase the vision, who are we, and a continuous of collaborating with M42, as we have delighted with the previous respected board signed an MOU with the M42 in April 2023. So this is continuous of a collaboration. Actually, we are a non-profit organization, has been established in 1981. It is under the Ministry of Community Empowerment and Community of Development Authority. Can I say the answer right now?
Please.
How many societies? We are, the society itself, the association itself composes of, till now, active 49 societies. It's not only...
Keep the number, please.
And it's not only for medical, however, it's for undergraduate interns and medical students for the allied health, which they work parallel with the physician. The society composes of medical and surgical specialties. We have working by all means, focusing on mission and empowering the healthcare professional to upgrade and to skill the agenda and the vision of UAE.
That's fantastic. And Dr. Noura, as the new elected president of Emirates Medical Association, what's your vision? What do you want to achieve
expansion and to be evolved, not as Noura itself, as an Emirati doctor who has and raised in a community and a country believe that we can do better and we are not less than anyone. Regarding the societies, we have so far 49, but as we have a new we have approved and established for new societies, which are the physician themselves and allied health. They are keen to develop and to work hand to hand. As your introduction mentioned, and I'll quote you, that we are stronger together, and this is a work team. So in order to progress, we need to initiate what is and to align with the new development and evolving with the medical specialties. So far, Emirates Medical Association and its board agreed to establish societies such as Audiology Society and Oncology Radiation and Lifestyle Medicine.
Fantastic.
Yeah. So this is till now we are 49. However, the 3 societies newly it will be elected soon, inshallah.
Congratulations. Thank you so much. Dr. Zuhair, as the Scientific Committee Chairperson of Emirates Medical Association, can you tell us more about this society? What is the vision behind these societies? And from a scientific point of view also, how can they collaborate more within the market?
As my colleague Dr. Noura has mentioned, if you go back in the history, back in 1981 when EMA started with one society only. It was the Dental Society. Now, as the time goes on and we evolve until we reach 49, but we're going to still grow more. So the idea of the society is like for a specific medical field. Like we have ophthalmology, have general surgery, plastic, now the new era. Also, we are like, modern. We have a new lifestyle medicine, regenerative medicine. This is all things going to come up as well. Now, the idea of this society is twofold. You have to see it as like the house for the healthcare professional. So we look at the well-being of the doctors, but also in the professional development of the doctors. So the continuous medical education, it's an important aspect in a physician's or health care provider's life. Healthcare is not just you go to university and you finish. No, it's a continuous life experience. So in the societies, the society will take care of their members, of the doctors, their well-being, but also in continuous their professional development. Now, by doing this, we have to also make some networking with the collaboration with the international organizations, international societies, international and regional also bodies. So this will make the networking for our doctors. Now, we also conduct the conferences. It's an important aspect. We also conduct workshops, symposium, and we have to basically now, the other aspect of this one is how can we bridge the gap between the healthcare professional and the community? So, then we do some activities in that regard, and we can elaborate on this one maybe more as we go on. So, all in all, the society is this house for the doctor. It's a house for the professional. And the house is to look after them in a social aspect, but also in the medical aspect and their development. So it's very important that, each of the society, they have board members. They will look after their members and their needs. We as the Emirates Medical Association, we will contact with the board of each society to look after their needs. So this is the hierarchy of the work, and that's how we establish as EMA is the mother house, and each society is the small house for that specialty.
Fantastic. You described, in fact, the relation with the society who are in UAE, but are you collaborating also with international societies?
Absolutely. We could, each of these discipline. Let's take, for example, the society I run, the Emirates Plastic Surgery Society. We have collaboration with all the international aesthetic and plastic surgery society. We have a collaboration with the American Society, we have a collaboration with the Korean Society. So all these big ones, they've been established way ahead of us, of hundreds of years. They're much bigger, so we have collaboration with them. And that's benefit our members, because our members have direct connection to these big societies. They can utilize their resources as well. And in this way, we make the whole world connected together. And this is one of the strategies of the Emirates Medical Association, the collaboration with international organizations, and to make the world as in one hub.
This is fantastic, and this is answering also to a question who came to us from several colleagues who are already enrolled in international societies, and they will ask always, in fact, how can I match both societies? So we answer to them that the enrollment in EMA and enrollment international is only empowering them, in fact, through having more resource, through collaboration. There is no contradiction in both, yeah?
Absolutely, and in the medical world, that we all volunteer working, and we all work for the best of our society, and the more connection we have and network we have is the benefit.
Fantastic. I think that the previous panel was about research and education, and that's one of the highlight of the Emirates Medical Association. Can you tell us more? How can EMA support all our physicians or our allied health for education, for research especially?
Well, the research is a pillar in the medical field. It's a very important aspect. So we in the Emirates Medical Association, we are actually empowering the societies to make, and we also push them more to support them to do research for the delegate. Now, the research, research needs funding, need collaborations with the different aspect. So in this way, now the Emirates Medical Association are actually, help them to get funding. We also might contribute in the funding as well. On the other hand, we also have the new Emirates Medical Journal. So now we facilitate for them, they can publish their study for free in our journal. And in this way, basically, especially in the young generation, we always look for the young generation, because they're going to build for the future. So this one, you need to introduce the research to them. So we're also aiming to do some courses for research, because how to write papers and all this is all skills that the young generation needs it. So if you facilitate that for them, I think we will in the near future, we will see more and more research being conducted in the country, but also in collaboration with the international big bodies. Same times, the pharmaceutical companies, they're always eager to find the scientists, to find the ground for their research. So if we can facilitate that, I think this will be a win-win situation for the industry as well as for our physician. And who will benefit in the end? Two things: the country, but also our community and our patients here.
This is fantastic. Thank you so much. I know how passionate you are about research, but you tackled the partnership. And here I want to come back to you, Sheikha Dr. Noura. You spoke about growth and partnership. Okay? What's your vision on partnership?
Actually, for partnership it's a broad terminology, and it's under several tracks. Partnership with the health regulatory bodies, such as the decision maker entities, such as the Ministry of Health and Prevention. Planning to collaborate closely also with M42 and extending the collaboration. DHA and DOH. This is with talking about the health regulatory bodies within the UAE. Regarding even facilitating our societies for conducting events. So we have a partnership and signed MOUs with the Dubai Business Event, Abu Dhabi Convention and Bureau, and ADNIC for facilitating any international conference which they have, which our societies attracted and invited the international well-recognized conferences to come and conduct their conferences along with the national society in UAE. So this is another chapter and another vision to have it empowered and to work on it. Talking about also collaboration with the other international medical associations and extending the partnership with them. So those mainly are our focus as a collaboration, and definitely working with the private sector here. We are one team, whether governmental or government. All of them are doctors. All of them are physicians who serve this community and work in this country. And they have a lot of initiatives that really fulfills the community itself. Also, regarding, not to forget, a very important entity, which is collaborating and extending the support with the universities. Universities are really important, especially with innovation, AI, attracting the students, and they can have like inspiration meetings with the seniors, with consultants to discuss about their future. So this is also another way of collaborating.
The mother house is here. Thank you so much, Dr. Noura. Okay. Dr. Zuhair, you tackled briefly the community. I want to come back to the community. Again, we speak about delivery of care, we speak about education, research, but after, how we go to the community? What are the efforts that you are doing, and what's your strategy, for the community as Emirates Medical Association?
Yeah. As I said, we are bridging the gap between the healthcare profession and the community. Now, we do a lot of campaigns, medical health campaigns, with the health authorities and sometimes independently. Like for instance, in the October we have the Breast Day, Breast Cancer Day. We have different campaigns that we contribute for the community. So basically, you'll see that the physician will be there, the healthcare provider will be there from the society, and doing the campaign and inviting the community to come. And and this is important to do this in various towns, not only like in Dubai and Abu Dhabi, in smaller villages as well, and all this. So these healthcare campaigns are very important and one of the pillars of our community. Now, we also something else. Now, 9th of May, every year, is the Emirates Medical Day. And this has been announced by the Minister Cabinet of the UAE, and it's considered the only day which we celebrate the healthcare providers. So it's not only doctors, any healthcare provider. So we like to announce this for the community. This is the only one day the healthcare provider, they volunteer, they sacrifice their time, their life for the community, and to provide the healthcare for the community. So there's only one day where we'd like the community to say thank you to our healthcare provider for all the time, for the sacrifice they do, So it's really, this is an initiative started just two years ago, and we see more and more that interaction of the community toward us. So we do something from us to the community, but we also now engaging the community on that one day, 9th of May, to say just thank you for our healthcare providers.
And I would like to add something that today Sheikh Mohammed bin Zayed has announced 2025 is the year of community. So we are talking all and working toward the community.
This is fantastic. Thank you for sharing this, Sheikha Dr. Noura. I want to ask you, in fact, as a president of the Ophthalmology Society, about one recent community initiative that you had to bring your patient, I think. Can you give us more details about this initiative, the RAFID, in fact, one?
You mean Rafiq
Yes.
initiative? Yes. So talking about the Emirates Society of Ophthalmology. Talking about community, and one of the vision is the cornerstone is to implement and closing the unmet needs, filling the gaps of the patient journey. We have a lot of diabetic patients, and we thought that we need to tackle all the challenges that the patient, when he presents or she presents to our clinic, what are the challenges this patient faces on a daily journey to the hospital. So we had like a brainstorm that why don't we, and this is a very nice initiative which have been really established, and it has been inspired by even the regional countries, collaboration between the Ophthalmology Society and the Emirates Endocrinology Society of Diabetes. We had a meeting of brainstorming how can we do the survey and to identify the challenges of the patients in their daily life. So it's a 5 years national program. By the end of the program, hopefully that there will be zero challenges to our patients.
Fantastic. And for the moment, I think that one of the main issues identified was access, and you are supporting the transportation of the patient, if am I understanding well?
Yes, one of the challenges is the transportation. And one of the facilitating companies that said that they can provide us a pick up and drop to the from the house to the hospital itself. Because some people or some patients, especially elderly, they miss their appointments, especially that they are relying on their children. And their children, of course, they are committed to their work. So this is one of the really challenges that some patients are missing their management or receiving injections into their eyes due to lack of transportation.
That's a fantastic initiative. Kindly, if you are from the Ophthalmology Society or any other society, in fact, come to Emirates Medical Association. There is a very practical initiative and you can support your patients. Then let me come to the audience and ask if you have any question for Emirates Medical Association. Sheikha Dr. Noura and Dr. Zuhair are here. Any question? If you don't ask, I'm going to ask. How many societies? Very good. How many new societies? How many new societies are coming? Very good. Okay. Yes. You have a question, please?
So, can you hear me? So thank you, Doctora, for explaining everything. So I have a question. You said you has mentioned that you are focusing more on diabetic patients. So do you have alternative route than the one we always have, the medication one? Do you have like something to change the diet, the lifestyle, which is targeting the root cause, not just waiting and sitting until people get sick and then we care for them?
Thank you so much for the question. Screening is very important. Screening patients on a monthly or annual basis according to the stage of the patient himself. So prevention is better than cure. Monitoring the comorbidities. Monitoring also and stressing the fact that we have to educate the patient that the importance of HbA1c to tackle the diabetic retinopathy and even the other diseases such as nephropathy and neuropathy related to diabetes. So screening is number one, and our primary health care, the endocrinology centers, they have the AI machines that facilitates detecting the pathologies in the retina.
So wonderful. So you said like early stage screening and we know exactly what's going on with their bodies. I'm a pharmacist. I used to sell pharmaceutical for a very long time, 10 years. And the problem with pharmaceutical in general, we never fix the root cause. We only give medications to just like mask the symptoms. But after that, once the patient is not taking this medication anymore, we can see all this like symptoms again showing up.
So prevention is better than cure.
There you go. So education. The first thing, besides the screening, education.
Yes, education
we have to
is very important.
There you go. Oh, my name is Hassan. I'm a pharmacist, and thank you for having me.
Nice meeting you, Hassan.
Thank you, Hassan. And I think this is also one of the initiatives what we have in the Emirates Medical Association is the campaign for education of the community. So, we work hand in hand with the health authorities basically to bring the message to the community how to prevent and how early screening and all these educational campaigns is very important. And we're not only focusing in the medical conferences, but we also come on the community development and in the working together hand in hand with the health authority to get the message to the community. Thank you.
Hi, hello, good afternoon. My name is Dr. Osama Tawfiq Khoja. I'm a corporate director, medical director for clinical laboratory service for Dr. Salman Al-Habib Medical Group, and also general director for medical diagnostic laboratories. It's truly a massive thanks supposed to be handled to Emirates Medical Association. This year, you successfully completed 42 years in serving the Emirates community in healthcare and the GCC countries. So thank you so much. My inquiry in Saudi Arabia, Saudi Society for Health Specialties, they have a classification based on a KPI that creates sort of competition between societies. I'm wondering, do you have a similar system, my dear?
Well, you asked the right person.
Well, thank you very much. Yes, actually, we did not have one yet, and I just finished creating a KPI for the societies. And basically, I started not very harsh on them, slowly. And basically, each society board, they have 3 years term. 3 years term. So what we're going to do is we're doing like annual revision of the KPI. And in the beginning, we're going to be very generous with them because, we work together hand in hand. And we know this is all volunteer work. But it's an important aspect to do KPI because especially when you have like 49 and plus 3 and, I think in the near future, we might reach even to 80 society and more. So we need to make sure that each of the society is active and developing our aim and objective of the Emirates Medical Association. It's not just I'm a president of that society and that's it. No, you want to be there, you want to be the board member, you're going to work. And when you're going to work, basically how we're going to assess that? Through the KPI, and this has been developed.
Thank you so much. To end our session, I think that the question were around a lot of future, EMA future. Then my last question to both of you is, what's next with Emirates Medical Association? Sheikha Dr. Noura and Dr. Zuhair, please.
Meeting our vision, working on it hand to hand together, not only among the physician, the strategic partners, and emphasize that we are aiming for a healthier community in UAE.
Fantastic, thank you.
I would like to see that Emirates Medical Association to be the platform, open a platform for the community to interact with the healthcare provider and the healthcare provider to interact with the community. This is the first. The second, I would like to be also a platform between the healthcare provider and healthcare authority in the country. So this will work together. We have all the experts that they need, and we can basically be, let's say, a third party to go with the health authority to be hand in hand to come to the ultimate, which is the best care practice for our community.
Thank you so much. That's really a pleasure to hear about the future, brilliant future from EMA. But also, I want to come back to our audience. How many physicians? How many allied health? Nurses? Who's going to enroll in EMA? Who's going to have partnership with EMA? Everyone. You don't need to be only a caregiver. Please, the business in the market, everyone. Yes, everyone on it? There's a lot of work who is coming. I'm sure that growth is there. Brilliant future is there. And not only, I think you said May 9, is it that? It will not be only one day to say thank you to Emirates Medical Association. Thank you to all our caregivers. Let's say thank you to all of you. 365 days, not only one day. Thank you, everyone, and see you in our next panel. Thank you to our panelists.